Hey everyone, it's your Sedative Physio, and here in this lecture we are going to discuss about the poliomyelitis. I have got so many requests about this topic, about the explanation of this topic. So here in this video I will start the poliomyelitis. This poliomyelitis will be covered in two different lectures. So this is the first lecture of the poliomyelitis, and here in this lecture we will mainly focus on the basic stuffs of poliomyelitis, like what's the introduction of poliomyelitis, the etiology of poliomyelitis, the pathological changes during the poliomyelitis, and the clinical features. So we will discuss these all stuff in today's lecture, and in upcoming next lecture we will focus mainly on the physiotherapy assessment as well as the physiotherapy management of the poliomyelitis. Okay, and if you want the notes of this topic, you can simply DM me on the Instagram or message me on the number of the WhatsApp that is given in the description box below. Or if you want the lectures in Hindi language, you can check out our other channel, Sedative Physio, where I upload all the lectures in Hindi language, and currently I am going with PT Neuro on that particular channel, and here on this channel I am going with the PT Ortho subject. Okay, later on we will move on to some different subjects too on this channel too. Okay, so let's start our today's lecture, poliomyelitis. Now, poliomyelitis can be commonly called polio. Simply we can call it polio. Poliomyelitis is an infectious disease that is mainly caused due to the attack of poliovirus. It is not due, it is due. An infectious disease that is caused due to poliovirus. So poliovirus is responsible for this poliomyelitis, and hence because of the name of this virus, the name of condition is taken, that is poliomyelitis. Now, after the infection, after the attack of the virus, in some cases the symptom of the patient can be limited up to some level of diarrhea or some grades of fever. Okay, about some grades of fever and diarrhea the symptom will be limited, but in others at the same time in some patients the virus may infect the anterior horn cell of a spinal cord. And now this is very important, and now this is very critical, because if the anterior horn cell of the spinal cord is damaged, then it can lead to paralysis like symptoms, some level of paralysis in the later life too, even after the recovery of the polio. Hence the poliomyelitis is very complicated condition. Okay, now in the extreme cases, if there is the infection of poliomyelitis, if there is the infection of poliovirus in the anterior horn cell, and if there is extreme case of infection, then paralysis can also occur in the respiratory muscles. It means in the intercostal muscles, in the diaphragm, the paralysis can occur. And if there is paralysis in the respiratory muscles, like if there is paralysis in the intercostal muscles of the chest, in the diaphragm, then it will lead to breathing complications too, and even the patient can be die. In such cases, in such extreme cases, when there is the paralysis of the respiratory muscles like the intercostal muscles, like the diaphragm, the patient can lead to death. So the poliomyelitis is one of the very complicated conditions that can be seen in the children. Now, if we talk about the method of infection, the way of infection, so poliovirus enters the body through two routes. There are two routes, there are two pathways of the entry of the poliovirus inside the human body. First is the fecal-oral route, and second is the inhalation of droplets. These two routes are very common. These two routes are the pathway for the poliovirus inside the human body. And this polio infection is commonly seen in summer. In summer, this polio infection is most commonly seen as compared to the winter season. Now, if we discuss about the pathogenesis, then the virus grows and multiplies in the intestine. So the primary place for the growth and multiplication of the virus, the nutritionism of the virus, is the intestine. The virus enters through either gut or through the inhalation of the droplets, and it will go inside the intestine of the patient. Inside the intestine, it will take up some nutrition, it will take up some nutrients from the human body, and it will grow. It will then multiply itself into different numbers. Okay, after a particular growth and the multiplication of the virus, it will travel to the regional lymph nodes and reticuloendothelial structure. Now, if it will go to the regional lymph nodes, then the lymph nodes will also be damaged, and the reticuloendothelial structure too. After this, the virus then enters into the blood circulation. So this is just the pathway of the poliovirus, that how it travels inside the human body. First of all, it will enter the human body either through the fecal-oral route or through the inhalation of the droplets, and then it will enter the intestine of the patient. Okay, inside the intestine, it will take some nutrition from the human body, and it will start to grow. It will multiply itself in different numbers. After the multiplication and the growth of the virus, it will then travel to the regional lymph nodes and the reticuloendothelial structure. From that particular lymph node and the reticuloendothelial structure, then it finally enters the blood circulation. Okay, now if the immunity and the defense mechanism of the body is low, see, if the blood has entered the blood circulation, if the virus has entered the blood circulation, now the blood is circulating throughout our body from the toe to our head. So if there is low immunity, if there is low defense mechanism inside the human body, the virus may enter the nervous system. As I have told you earlier, that in some cases only diarrhea like symptoms or only some grade of fevers can be seen as a symptom, but in some cases there can be a paralysis, and this paralysis is generally occurred in that condition when the patient's immunity is very low, when the patient's defense mechanism is very low. Okay, so if the immunity and the defense mechanism of the patient is very low, the virus will cross the blood-brain barrier and it will enter the nervous system, especially the anterior horn cells of spinal cord. Okay, and it will damage the anterior horn cells of the spinal cord. Now, whenever the virus will enter the nervous system of the patient, three types of changes can be seen. First is the permanent damage. It means whenever the virus will attack the human nervous system, the neurons will undergo permanent degeneration. It means there will be the permanent death of the neurons, and if there is permanent death of the neurons, there is no recovery of the particular neuron. This is the first condition. Now, second case can be the temporary damage. It means that there will be the partial damage of the neuron. It means the neurons that is being damaged can be regenerated. There are some chances of the regenerated, but it will not regenerate at its best. Okay, it means that it will not regenerate completely. There will be partial recovery, there will be partial regeneration of the particular neuron, and hence in the temporary damage there will be partial recovery of the patient's symptoms. Okay, now the third condition can be only functional impairment due to the tissue edema. It means in some cases the virus can only lead to the edema in the tissues, especially in the neuroglial tissues, and it can lead to some functional impairment. Okay, this is the mildest form of the poliomyelitis infection. This is the mildest condition of the poliomyelitis infection. Okay, now permanent damage can lead to the permanent paralysis. If there is permanent damage of the patient, if there is permanent damage in the neurons of the patient, now it will lead to the permanent paralysis because there is no chance of recovery. Now again, this is why, because there is the permanent damage, there is the death of the neurons inside the nervous system, especially in the anterior horn cells of the spinal cord. Now, if there is partial damage, it can regenerate and will lead to partial recovery of paralysis. As I have already told you that in the case of temporary damage, there can be chances of the partial recovery. The recovery will occur, but it will not 100% recovery. Some level of recovery will occur, but still the paralysis will persist. It means that there will be the partial regeneration of the neuron and hence the partial recovery of the paralysis. But in case of this temporary damage or the partial recovery, this can further lead to different serious complication in upcoming future. Which type of serious complication? Now the patient will be recovered, it will be partial recovered. Now again, after the partial recovery, in the latter stage of the life, even after the recovery of the patient, mind it, even after the recovery of the patient, in the latter stage of the life, some different complications can be seen, and that's called the post-polio syndrome or the post-polio residual paralysis. Okay, in the condition of partial damage, in the condition of partial paralysis, in the condition of temporary damage of the neuron, it in the latter stage it can lead to the post-polio syndrome or the post-polio residual paralysis. This post-polio syndrome basically includes some symptoms like the deformities of the joints, like the muscle wasting, and many more. We will discuss it in the next slide today. Okay, so basically these three types of changes can be seen in the neurons when the poliovirus is attacking the neurons of any patient. First is the permanent damage, second is the temporary damage that will lead to the post-polio syndrome. Now the permanent damage cannot lead to the post-polio syndrome. Now, why? Because there is permanent damage, there is permanent paralysis of the patient, there is no chance of recovery. Okay. And the third one is the only functional impairment due to the tissue edema. Let's move on the clinical features. So if we talk about the clinical features, initially the patient will be the child of around 9 months. When the patient will come to the pediatrician or any other doctor, the child's age will be around 9 months, and hence the child will not able to speak his or her complaint. So the mother of the child will explain some history of the child, like the mild pyrexia, as I have already told you that some grade of fevers can be seen, diarrhea, inability to move body part or the whole body. So these three histories can be seen in the patient with poliomyelitis in the initial stage. The first one is the mild pyrexia. It means the mild fever. Second one is the diarrhea, and third one is the inability to move body part. It will be there will be some difficulty in the movement of any specific body part, or it can include the whole body itself. Okay, now lower limb is most commonly affected in the case of poliomyelitis. Paralysis can be asymmetrical. It is very important to note down that the paralysis in the poliomyelitis can be asymmetrical. Headache, nausea, vomiting, this can also be seen. Muscle weakness will be there. The patient's muscle will be very weak, and there will be the condition of hyporeflexia. Hyporeflexia, it means the reflexes will be very decreased. There will be decreased neonatal reflexes. If you check the neonatal and the primitive reflexes of the patient, the reflexes will be decreased. Apart from this all, if we divide the symptoms in the early and in the post-polio syndrome, so in the early stage, apart from those common symptoms that we have discussed just a few seconds ago, in the early stage, quadriceps can undergo partial paralysis commonly. There are some group of muscles that are mainly affected. So quadriceps, if we talk about the quadriceps will go partial paralysis. Generally, it is seen that in the condition of the poliomyelitis, in the early stage, in the initial stage, the quadriceps will undergo the partial paralysis. Apart from the quadriceps, tibialis anterior, this will undergo complete paralysis. So we have to keep it in mind that the quadriceps will undergo the partial paralysis commonly, it is most commonly seen, and tibialis anterior will undergo the complete paralysis, and in hand the opponent's pollicis is commonly affected. These are some common areas, these are some common muscles that are affected. Now in the post-polio syndrome, muscle wasting is seen. Okay, in the post-polio syndrome, muscle wasting is seen. There will be deformity. Deformities can be seen in the hip joint, in the knee joint, in the ankle joint. In the ankle joint, it is most commonly seen like the equinus deformity is seen in the condition of polio patients. Okay, so deformities can be seen, and if there will be deformity, contracture can also be seen in the patients of polio. In the upper extremity, it generally affects the elbow and shoulder muscles. Elbow and shoulder muscles will be affected. There will be weakness in the muscles of the elbow and shoulder, or contracture can also develop. Limb length discrepancy or the limb shortening can also be seen in the patients with polio. Now, common deformity. Let's talk about some common deformities that can be seen in the patients of polio. In the hip joint, flexion, abduction and external rotation. The hip joint will undergo flexion, abduction and external rotation, and this will be the deformity for the hip joint. Knee will undergo the flexion deformity. Foot will undergo the equinus position. The ankle joint will undergo the equinus position. And because of this deformity, the gait can also be affected. The gait of the patient will be highly affected, because if there is any deformity in the lower extremity, there will be no proper gait parameters of the patient, and hence the gait will be highly affected. Okay, now these all symptoms are along with the common symptoms. So as I have discussed, these all clinical features, these all symptoms like headache, nausea, vomiting, muscle weakness, decreased reflexes, these all are the common symptoms. But in post-polio syndrome, the decreased reflexes etc, it is not seen so commonly, but still these are the common symptoms. Along with these common symptoms, in the early stage, these three different conditions can be seen, and in the post-polio syndrome, these conditions can be seen. Let me clear you that these symptoms are not limited. I have only discussed here some common symptoms that is commonly seen in the patients of the polio. Apart from these all symptoms, there are much more clinical features, there are much more clinical manifestations that can be seen in the patient of polio. Or if you have any issues regarding these clinical manifestations, you can let me know. I will make sure that I will discuss it briefly in the upcoming lecture. Now I hope you all understand this lecture. If there is any issue with this lecture, you can simply ask me in the comment section, or message me or DM me on the Instagram or WhatsApp. I will see you guys in the next lecture. Till then, be happy and keep learning.